have chronic pain in my left hip.
My lower back.
I have multiple sclerosis, and it has a lot of pain that goes along with it, a lot of mobility issues, so my gait, how I walk is impaired.
There is no one type of pain. I've been a nurse for 40 years, and I can honestly say this is probably the hardest aspect of nursing I've ever done. We look at each other and say, what do you mean you're in pain? I don't see anything. I don't see blood. I don't see scars. I don't see a bone. It's something people can't see. So it's very, very hard for people to understand why you're tired, why you can't do that activity. And it's up to our doctors to get that person out there back into full function as much as possible.
Our global philosophy is basically we try to look at the function and the quality of life of the individual and tailor our treatment to maximizing that.
The diagnosis process wasn't complicated. I was surprised at how well the doctor listened and understood what I was going through.
The doctor will do a full exam of the patient. He will read the history of the patient, the surgical history of the patient. He will talk to the patient and have the patient express exactly what they're concerned with. And then we will maybe order some tests. And then the doctors will sit and talk to the patient about a plan of care. These are your options. This is what I think it is.
Two people with the same diagnoses can not respond to the same therapy. So it takes a complete holistic look at pain to get it just resolved, everywhere from the psychologist, the physical therapist, medications, of course, and then the interventions that we do as far as our therapies and treatment.
You want to try the most non-invasive thing first, and then go to where you need to go, if you need to go there, because a lot of times you don't need to go there.
Sometimes medications can be helpful. A lot of times injections or procedures can be helpful. Physical therapy is almost certainly helpful because usually the patients have had chronic pain for years or a decade or longer. Psychology is a fundamental part of getting them better too. Anxiety and depression are pretty problematic with chronic pain.
The scientific community now agrees that every pain experience is made up of a physical component and a psychological component. And that's where pain psychology comes in.
I'd say probably the biggest thing that sets us apart, we have a pain psychologist that works in our same department, and especially for patients that are more challenging and more complicated, that really gives us the opportunity to be able to intervene in a way that can be more helpful for them.
The experience of visiting Shepherd is easy. My first visit was just a phone call to schedule an appointment. And you show up on campus and parking is convenient. Come in, you go to the window where a friendly face is there to see you and help you through the paperwork that they need for that day.
Too many people don't ask for help when they're in pain, and what happens, they're sitting on their couch, their family starts to split apart, and they feel like their life's over, and it's not.
Really about investing in that person as a human being and their family, and really making sure that we're doing the best for them that we can.
It's like a home away from home. It really is. They treat you with respect and dignity, and it feels supportive, that they truly understand what you're going through and what's kind of happening. So it's for me, it's been, for a hard situation, a very wonderful place to go.